and she ended up hadn't done anything. And then the other day, her neighbors were getting yard work done, and he was freaked out with yard work. And he went after one of Nina's wooden toys. He went from like love everyone, it was like expensive, like destroyed it. So, yeah. And she was like, he's just a dog. I'm like, yes, I can get mad, especially when he hasn't done it in 2 years.
I think dogs, the thing about dogs is that they're like kids, like, yes, we are.
Just had to think about it for a minute. Strange.
Move on probably till August, because I called Apple, they couldn't give me their answer. Tried it. 34 minutes to your store. So.
Sure.
I don't. Yeah, for people, actually, for people who are watching this and how to ask questions. We're kidding. It's okay.
Everybody's muted.
Okay, so they just don't ask
Are they
questions.
missing an app? They can put it in the chat or something.
Yeah, you will see the chat come. They do have permission to unmute themselves, but they open to not to.
Okay.
Okay, gotcha. And they'll be able to hear us like over and.
Yes, so you got speaker and microphone in the camera.
Perfect.
Okay.
And they won't listen to us.
Correct.
Thank you guys.
All right, you have-
I just have a question. Don't you happen to have like a place where I can put something on?
We do not have a business center.
So do you know what I can do? But I thought, yeah, that's.
Of course, someone at the front desk, if it might be able to.
It's not in the world. Thank you.
We grab that.
Okay. So something.
Oh, perfect. So we got this.
What is that?
Which time is this?
Oh, is it like a pointer?
That's fine. While you're talking. I'll just see your slides. Yeah.
Can we turn, oh, so can we stand? Can we turn the computer around? Can I stand to the side maybe? I understand right there.
Yeah, sure. The team driving stuff is really good. I mean, she's not gonna drive until she has ADHD. Epilepsy.
Right, it makes it more complicated. Yeah, it's, I mean, I think, obviously my husband travels a lot, but that part of me wants to drive.
Yeah.
But I mean, the main times he's gonna be driving, and I want to really know him, because we would also be like a sister probably about it.
Yeah.
So do I want to, my own, my children driving the car. Or down the one.
Oh, right.
No,
We're chatting.
We're just.
We're chatting about teen driving.
Next, we're talking about the remote car. But yeah, I know, so I think that's my, it's just like the person who has to straight for childcare.
Yeah.
When I can't find anything, can't find this, or can't find that person, we have to find, so that person is like, yeah. I don't need that for a long time.
Yeah.
Yeah, one time his buddies, he was having a sleepover and his son was in it. He wanted me to take that. I was going to take him on my time, his time. And he said, oh, my friend's not having me yet. I was saying, just I was like, yeah, she's a car. This is what I saw.
Oh.
That doesn't really matter because your friend just got assassinated. So then they want to come to me and tell me that the friends I'm on was coming. And so I mean, I was going to take it. Maybe it started to be I was like, why do you sleep over?
Yeah.
I just didn't want to leave the house. And as going somewhere, it's actually not going to so I was going to the game, and I was like, I'm going to go to the game, and I was dropping off on my way. I'm leaving my house twice. So anywho, he tells us this or whatever, and then he yells at me and yells at us, hey, mom, yeah, my friend's mom is here, and he runs up to her, and I'm like, I'm going to say hi to her. So I'm like, why are you running that way away?
How are you doing?
And apparently, the friend's mom. It's just his friend. I was like, oh, that's that. And so we almost didn't let him go to sleepover. So it's like, let's go to sleepover, but don't play us. So we're gonna go, they just want to go back. And the girl, my son told me that extra. The same friend is like, all the time. They were going to 6 Flags together with this friend, a whole bunch of friends. And this friend was having a sleepover after 6 Flags at his house. And I said, I need you to ride up to the house because I can talk to mom. Take the road. See, once again, I had his license form. Plus, there was a whole bunch of teenage boys in the car together. It was not so good. No. So, anyway, the funny thing about it is the mom or one of his friends made a ride there, stepmom dropped her son off at our house, and then I took the son there, and then she picked him up to the place. And so I was like, oh, it's a nice friend, or whatever. You know, that is, he thinks that's my son. She doesn't want to son in the car with any. And then this last weekend, he went over to like sleep with some other friend right now. Before I talked to mom to like safety kind of discussion before I let my son go over to the house. And he was just telling me, like, I saw my I was asked you more firearms and whatever. And I was like, oh, and CDC and did it, and I'm like, that's not remember, so just good. So I got from my son, I'm like, you could have told me this mom's a doctor, you might have not had as much of books. I was really very, I'm like, oh, you know, look here, say you told that all these parents that know you want to so brothers with that's like,
Yeah.
that their house is gonna have the dangerous things that I would not, just less like.
I haven't sent people over to anyone's house for a play day ever because of her
Yes,
procedures.
it's a lot, it's more complicated.
I have to send it over for a play day. I need to invite her over for another. He got along amazingly well with her daughters. They like really, like I think the three of them actually had a blast. It was a lot of fun. We watched them on my ring camera down in the living room. It was great. And I'm like, I'm gonna encourage this friendship because I know just until it's too right. And if anything happened, she knows what to do.
Absolutely. So that's what I kind of like, my heart, sure. My son's, it's been a little bit harder to get friends. And I have mom friends with my daughter, but I don't have mom friends with my sons at all. And I feel like, I don't know, I feel like maybe I did at times. Well, yeah, not really that much. Yeah, and I think what happened was when they were really good, and then I had Soraya. Yeah, and then it just kind of like, I had friends and I had mom friends for her, and that's Soraya, like they were afterwards. And so that's what happened was that I had where I graduated. It's really hard with my kids' ages to find someone who has the spread that I have.
Oh, yeah, nobody has to spread.
It's, if I find someone, yeah, if I find someone, it's fair. So, and if I do, it's someone like Leka, who did the spread for me different genders. And that's, so Leka, we actually do have, Leka with Leka. But Leka's oldest is a girl, so I can't do both.
Yeah.
Because my son's gonna be that was good. More than why I'm going here.
I think maybe people need to be agreeing with the part too, because I love the parents that were encouraged. I knew the Fraser Center and these other parents would. They're very evidence-based, like I love them, I love hanging out with them. Consider them friends. And this new year that she's in, I haven't really connected with a lot of parents.
So she repeated this year or
So
she
she repeated last year, so she repeated. When you go, they're organizing plays, or like playground, and the same thing. I'm like, oh, I don't know if they just.
Yeah, well, I would say that my son's I have done. And so I have met two so far. And I know that and so my son
Hi, guys. They wanted you guys to start to sign in. I'm just gonna pass this around, okay? And that is yours to keep. The little wooden, whatever it is. Hey, how are you? It's a puzzle. Yes. How practical it is. Take this puzzle.
what did you say about this?
It expands flex too. So you don't have to stay, right, but if you don't want to, I don't really see. So.
But this is for Valentine's Day.
Yeah. I don't know how long I could say.
Oh, what is that?
Oh, and that's like a timer too, right? Like sometimes they're like for a specific time. They like big fancy ones like this, so. So I can just be like 15 minutes. Yeah. Oh, it's not that long too. It's
Like 65.
you take the time. Discussion is breastfeeding.
I'm not really sure.
From
lighting up right now.
Where did you get?
The wood from
Yeah, I didn't know. Do you leave on this? Yeah.
We'll just leave it there.
You just leave it there and then.
Like, it's probably more minutes. I'll be back later. Job and white. I'm gonna watch it. Definitely need different types of driving skills. At all, it's about stuff we do about it. Stuff from nowhere. Like just an hour north of Salisbury, so. So my father. South Carolina, South Carolina. That's where he's.
Oh, okay. Did anybody live?
My mom lived in Dalton, but I only spent summer.
Okay.
That's why I would visit, but there's no this many important interstate. A classic teenager, one day I went on the interstate, I just went on one exit, one exit to the next exit by myself, and I was like, oh, that was terrifying. I won't do that. Growing up where you don't have interstates at all, and you're like, and it's Georgia interstate, you know. Interesting. Because you were on the eastern shore, you were on the river, right?
Yeah, it wasn't enough. Yeah, I tried to. The Eastern Shore also doesn't have.
It isn't, it is.
Yeah, but when I was raised in Alabama, my interstate was the interstate 20 was learned driving to California school.
Yeah, I still remember the first time. I heard it was 285 in college. So scared.
Sign in sheet funding.
Here's time to get that on.
Where's the signage? Oh, it's going to be passed around, perfect, so we'll start, we'll do it for like 2 more minutes and then we'll start, so.
This is right now.
So good morning. I hope everyone is having a great one. My name is Manisha Agrawal, and I am a pediatric emergency medicine physician at Children's Healthcare of Atlanta and Emory University School of Medicine. And I am thrilled to be here to talk to you guys today a little bit about adolescent injury prevention. And speaking with me today is my colleague and friend, Dr. Fraser Doe, who is also a pediatric emergency medicine physician at Emory Children's Healthcare of Atlanta. So today we're going to be going over some basic overall epidemiology when it comes to injury-related deaths in adolescents and then really doing a deeper dive into firearms and its impact on adolescent well-being. And then if we have time to talk a little bit about other injury-related causes of death and disability in the adolescent population. So when it comes to epidemiology and injuries, if there's one thing that you guys remember from what I'm going to talk about today, it's that injuries are the #1 cause of death of children in the United States. Okay, preventable injuries. And this includes adolescents. So this whole conference is focused on adolescent well-being. If we want to save the most adolescent lives, we have to focus on injury prevention. Diving into the data a little bit more, this is data from 2020 from the CDC. And you have here on this graph the 5 leading causes of death. Each column represents a different age group, starting at under 1, then 1 to 4, 5 to 9, 10 to 14 years, and then in 10-year increments. All the way over on the right are the leading causes of death for Americans across all age groups. So what I want to highlight for you is all the blue boxes are unintentional injuries, so accidents, right? And you can see that it is the leading cause of death, not just for children, but even for adults up to the age of 44. I am still in my 40s. That is the most likely thing to take me out, is an unintentional injury. In the under 1 age group, you can see that's listed number 4, but you have SIDS right above it, that's number 3, which we usually think of that being unsafe sleeping environments. So the only things that top those out are things like babies who are born prematurely and babies who are born with congenital anomalies. So kind of a very different area of public health if you think about it. And then when you look across all ages, unintentional injury is the 4th cause of death in our country. I also want to highlight that you have an orange homicide and in green suicide. These also fall under the purview of injury prevention. We'll dive into just a little bit more. So again, keeping in mind that injuries are the leading cause of death, not just for children, but even for young adults and some middle-aged adults as well. Looking a little bit further, these are the injury deaths for children in 2020. The top line in purple demonstrates all injuries. So what you can see is over here, kind of elementary age, preschool age children, all injuries, intentional, unintentional, accounted for roughly 30 to 40% of all deaths, okay? But as you get older, injuries start accounting for more like 70 to almost 80% of deaths of adolescents and young adults. The green line underneath it depicts unintentional injuries. So you can see most of the injuries from our preschool age, elementary school age kids tend to be unintentional, but there's this gap as our children get older. That's where more and more intentional injuries like homicide and suicide come into play. So to put it another way, in 2020, there were 17,804 adolescents aged 11 to 21 who died due to a preventable injury. Okay, so 17,804. When you just look at these injury deaths, motor vehicle collision and traffic accidents accounted for 26% of those deaths overall in that age group, followed by poisoning for unintentional injuries at 18%, and then drowning at 3%. The rest of the unintentional injury deaths are relatively small in their contribution when you look at these 17,800 of deaths, right? But if it's your child, that's not a small contribution, obviously. Yes?
Just a quick question. Why did you use the range?
So that's a great question. It really depends on how you look at the literature, but technically we come from the pediatric field. Pediatrics will actually include up to the age of 21. And if you look at adolescent medicine clinics, they will sometimes actually go up to the age of 25 years when it comes to taking care of patients. When people talk about adolescents, so you will actually see different people use different age ranges. So we tried to pick a range that we felt was like a nice kind of middle ground, where we're still getting some of the younger age groups, and we're not necessarily going up to the 25-year-olds, but we are still getting up to 21. From another perspective, our children's hospital will actually, when we're not in high volume times, will actually take patients up to the age of 21 without a problem. It's a great question. When it comes to intentional injuries, you can see that suicide and homicide respectively have 23% and 25% contribution to these injury deaths. Yes.
What type of poisoning are you referencing?
We're gonna dive into that a little bit more, but it is primarily opioid poisoning, as you can imagine. Now, if you guys pay attention to the news and just public health in general, you probably know that we keep hearing the AAP and other groups harping on firearms are now the leading cause of death of children, right? So how does that play in when we have this pie chart? So we know that in 2020, there were 113 adolescents, 11 to 21, who died from unintentional firearm injuries. So they were playing, they found a firearm, they're like, oh, what's this do? And it went off and it killed someone. But when you look at the homicides and suicides, that's where firearms are really impactful. Firearms were implicated in 93% of the homicide deaths in adolescents and 49% of the suicides. So think about that. If you take firearms out of the equation, how much smaller those slices of the pie chart fit? When you look at firearms overall in this age group, they accounted for 35% of all of these deaths, 17,000 children who died. But we know that deaths are also just the tip of the iceberg, right? We're focusing on deaths right now, but for every child that dies, there are 27 more who are hospitalized for medical care. Some of them in the ICU, some of them with significant disability and lifelong challenges from the injuries they've sustained. We know that roughly 1,000 more are going to require treatment in an emergency department for the injuries sustained. And countless others are going to need to go to their local doctor's office to get urgent care, but they may not even come to medical attention, right? Sometimes grandma knows best and can actually take care of some of these basic small injuries. So with that, I'm going to turn it over to my colleague, Dr. Fraser-Doe, to talk about firearms. I think it's super important since that's the cause of injury-related deaths in this stage.
Right, guys. So another thing, I just want to piggyback on your question about the adolescents and what people kind of cut the line at. A lot of pediatricians in general, and also people who deal with just medicine in general with children, will often talk about the prefrontal or the frontal lobe and how the maturity aspects. So that's another reason why people sometimes will cut off at 21. And I will say, before I get into my data, that there are lots of different sources that gives us information about firearm injuries. And for lots of different reasons, which I'll explain later, the data sources will give us different ages. And so the CDC, which is where we got some of our data from, that you can easily slice and dice their data for deaths up to like whatever you want. I can tell you the deaths of all 10-year-olds, but some other sources are not as easy to slice and dice. So some of my ranges are not going to be exactly the same as that. So you'll get a little bit narrower of a pattern too, okay? So just to kind of delve a little bit more into firearm epidemiology. So as Dr. Agrawal just mentioned earlier, you've been hearing the news, of course, leading causes of death in children in pediatric patients, and this one specifically ages 1 through 19, is firearms. So one of the things I wanted to kind of show you is how this actually changed over time. And this is a great chart of how you might have heard things a little bit differently. So let's see, oh yeah, the mouse is actually showing me. So as you see, firearms on this chart has been the second leading cause of death since like the late 90s. But if you look at other data sources that only talk about children up to 18, they actually had neoplasm as the second leading cause of death up until about 2003. And then it actually got surpassed by firearms. So there is differences in looking at sources. It's always good to look at the ages that people are studying. But if you look at the whole scope of time from 2003 to now, there has actually been a 19% increase in death by firearms in this age range, where there's been a very significant decrease in death in neoplasms. So basically, 19% increase in firearms, where there's actually been a 17% decrease in cancer. So this chart made news a couple of about 2 or 3 months ago. They basically looked at the CDC data from over, and they ended basically 1999 to 2020.
So this is primarily large increase versus shift towards
So not really. So, but there's a difference in the homicide, and there's a difference everywhere. So there's in the urban areas, it's actually homicide, and the rural areas, it's actually suicide and unintentional. So it's increasing everywhere. But good question. So I wanted to kind of slice and dice in this, and I said, all databases are different, so I'll tell you about this database. So this database is called the Gun Violence Archive. The one that you just saw before was from the CDC. And so the Gun Violence Archive is actually uses their sources through actually newspaper reports. And so there is no, at this point in time, real-time data source that actually tells you about firearm injuries that is government-based. So you can get delayed information, but nothing real time. So if you want real time, Gun Violence Archive is one of the few sources that are out there, and they've been out there for about 10 to 15 years. And so every year, every day, they call the newspaper clippings, and they document firearm injuries and death. And so they actually slice and dice their data from 12 to 17. I go all the way up to 24 with my other option. I thought I'd just give you all 12 to 17. And so for their data, as you can see, each year, there has been an increase from 2019 to 21 in the amount of the morbidity and mortality. So you'll see that there's been a 58% increase from 2019 and the number of teenagers from the ages of 12 to 17 have been killed, and a 44% increase in those who are injured. And part of the reason why there is not a lot of good resources is that there was an amendment that was actually passed by Congress in the 90s that prevented the CDC from collecting really great data. That amendment has now been changed, and so they can, and we'll talk about in a few minutes about how they actually are collecting, starting to collect real-time data. So I thought I would give you all real-time data. So if you go up until, I think yesterday or 2 days ago, I stopped counting because I wanted to make this as complex as good as possible. From the ages of 12 years to 17 years old, there have been 711 teenagers who've actually been killed. So that's this year. And there have been 1,890 that have been injured. And if you compare that to last year, we are now about halfway through the year. But these are last year's data from Gun Violence Archive. So basically where we are right now is at 65%, we're basically at 65% of what happened last year. So if we continue on these trends, I would imagine we'd actually surpass last year's data, unfortunately, with the kids who are actually being killed and injured. So it's, even though it's important to talk about firearms as a whole, what gets all the news buzz, of course, is mass shootings. And as someone who does research and firearm injury research, this is where people talk the most because it gets the news. But you realize that actually mass shootings are only about 0.08% to like 1% of all the firearm injuries and deaths, such a small percentage of what actually happens. But I thought I would give you all a little bit of slice and dice information about it because that's what the people hear about. And it actually is what gets talking, gets amendments passed and bills passed, is when it actually gets laws passed because that's what people hear about. So mass shootings, as I mentioned to you before, about 1% of total gun violence. As of July, there have been 330 mass shootings and about 15 mass murders. And I'm stopping and kind of give you some explanations. Something else that's really confusing in this firearm injury world is mass murders versus mass shootings. So the FBI uses kind of like the mass murder kind of deal, and their idea about that is, actually FBI actually calls it active shooter. And what active shooter is an event that usually the ones you hear in the news, but it's actually in a public place and 4 or more people are killed. But there are lots of different definitions. Some people use it by just the amount of people who are injured or killed. Some people actually talk about it based off of the perspective of the different victims. Some people include the person who's actually the shooter in the death. Some people do not. So it's really a lot of different sources use lots of different information. But this source basically considers mass shooting any event where there was lots of people where the shooting actually occurred, and then the mass murders were 4 or more people were killed. And this is also from the Gun Violence Archive. Yes.
So what is that source information? I know this is not, I guess, print newspapers as growing as used to be. And so it has a reporting unfortunately improved since things have gone online.
Yeah, so it has. So Gun Violence Archive, which is what this source is from, they use online databases and they also use news media, so like actual TV news media too. So they use multiple different sources, like 7,000 different sources. So And some of their data actually has been validated against the CDC and actually matches up pretty well. There are some, because they have to go back, of course, a couple of years when CDC data comes out. CDC's data is for deaths, I will say. Only, and I'll talk to you in a moment about why it's not actually for real-time injuries, but the CDC data for death has been validated against the gun violence archive, and for the most part, they match pretty well.
That's what I think it's about, the thing, because I've seen recently, social media pages, used to pull their information from pages. So they catch that, because probably it's page, no one is calling it that, and so doing that, so they have that to be accounted for.
Good question. And I don't know if gun violence archive uses information specifically. They say you use resources, but like if they use social media sources. I am quite familiar with Atlanta Uncensored. Actually, my son has educated me on that, my teenage son. So who knows if that's great information, I want to focus their own time. But yeah, I do not know if they actually use social media the way that they, on their website, they specifically say use media sources. Yeah, but that's a great question. So one thing I wanted to point out though about mass shootings, and this was something we talked about a little bit with some of the legislation. 6 of the 9 deadliest mass shootings that actually occurred since 2018 were committed by people who are under 21 years of age. So I think that's important for us to think about, especially as we talk about the ages of what constitutes a teenager and thinking about firearm injuries in general. And one last thing I wanted to point out is that the FBI, when they look at their active shooters, remember that's 4 more people killed in public place. Actually noted that was in 2003, 2000, there were only 3 what they titled active shooters. And 2020, there was actually 40 of those things. So they have noticed a significant increase. We all kind of feel like there's an increase, but they actually pointed out that there's definitely an increase. This is just a map that just shows kind of where the mass shootings were in the United States this year, and it kind of shows like the different how kind of incrementally where it increases and things like that. And this is something I wanted to kind of point out. So 256,000 children have basically been exposed to school violence within their school and experienced gun violence in their school. Once again, all these shootings make up a small amount, and you'll see a study later on that I'll talk about where there's actually a higher experience that children actually have with gun violence that they experience in school, but they're also experiencing other places. But I thought that was a really important thing to point out. I will say that there's 49 million school children, so that's still less than 1% of school children have actually been exposed to this. And this is just a listing of kind of like all the different school shootings. There are I believe it's called Education Week, actually keeps a list of like all the different school shootings and the numbers of school shootings. Of course, so you'll see Uvalde and Newtown, which are the elementary school shootings that people kind of often refer to frequently. So now that we, of course, like I said, we have talked about mass shootings because it's out there. We talked about that. We're going to now go back to just firearms in general, okay? So a lot of times you think about like, you look at some of my data and you wonder like, how did COVID-19 kind of impact how it impacted gun violence? So in times of stress, just based on the culture of our society, there are increases in gun sales. And so during the pandemic, where some people, healthcare providers are grabbing masks, other people felt for their safety, buying a gun would make them feel more safe. And so there was a rise in gun sales. The FBI showed a significant increase in kind of March, April, the beginning of the pandemic. But there's also an increase in gun sales actually based on political climate and also based on elections and also based off of mass shootings. We're just hearing about violence. So there's lots of things that actually increase gun sales. What we find is that there are more guns in the home, that increases access for children. So homes with teens during the pandemic, 2% of them actually acquired a new firearm. And 3% of those people actually became first-time gun owners, meaning they didn't own a gun before, and then they bought one during the pandemic. And so what we found was that because there was increased access, there was unfortunately rise in mental health issues and domestic violence, there was then an increase in unintentional use
adolescents and children, which is what kind of shows you that big difference between 2019 and 2020 and 2021 that I showed you in the graph a few graphs ago, and it increased the homicides in children too. So unintentional firearm abuse and homicides involving children dramatically increased during that time period. And firearm suicides have increased about 38%.
What time to what time?
So basically, starting from the beginning of the pandemic, which would be the beginning of March 2020. And this data basically kind of goes up until 2021. So I don't know how what happened after the middle of 2021.
You said, what was the percentage?
Oh, the percentage increase in firearms, 30% increase in firearm suicides for teenagers. So my firearm, so what are the risk factors? What makes people more likely to be injured by firearms? So males, if you look at like just, first active shooters, it's other publicity, like 95% of active shooters are males, so a very significant percentage. Adolescent teens, so if anyone has been an adolescent, all of us have been, anyone have an adolescent, raising my hand, teen, they're impulsive. So that is part of it. Living in low income areas, so poverty has a lot to do with it. We're going to talk with you in the presentation about things we do to prevent some of the firearm injury and poverty reduction strategies is something that we can do. African Americans, there's a difference between homicide versus suicide. So earlier was asked about where the increases are. So we talked about the fact that homicide is more of an urban thing, and suicide and unintentional injuries have been increasing more in rural areas. So one last thing that I wanted to point out is this graphic over here, that Black children and teens are 14 times more likely than white children and teens of the same age to die by gun and homicide. And so this impact has a lot to do with a number of areas. So part of it is the living in low income areas has a big impact. And so, and then of course, the second thing is the urban compact. But if we're talking about real and we get to all the details, that is going to take a little bit more evidence than we have time to talk about today.
Question.
Yeah, go ahead.
When you, in terms of gun ownership, and if you look at Black life, you have that kind of comparison?
Yeah, so that's a great question. I don't have the percentage in this talk, but what I can definitely tell you is that about 50% of Georgians own gun. Georgians in general. It's actually 49.2%, that's too close to 50. There is actually been an increase in every single ethnic group purchasing guns since the pandemic started. Every single one. So there.
And the pandemic also coincided with elections.
Exactly, it did. So there definitely could be, but most of the spikes that the FBI, so the spike kind of went up and stayed. So when you look at like the FBI, and this is based off background checks, so that's how they're able to figure it out. And that's, which is a whole other discussion, which I'll get to that sort of, and some of these questions y'all have me skip, but that's okay.
Okay.
So background checks are done when you buy from a federally licensed gun owner. And so that's how they're able to see. But if you don't buy from a federally licensed gun owner, I don't know what you did. And I'll talk to you about that in more detail. But that's how they figure out the spikes. And yes, so there's a spike in everybody. It used to be that most gun owners were males. It's still more like female, but there's been an increase in females too. So the ethnicity thing is not per se a big difference, as you might have thought. So I wanted to kind of talk about Georgia, since we're from Georgia. So this is a graph of kind of like the increase in Georgia from 2017. I went back a little bit further. So 2017 all the way to 2020. So there has been, this data specifically, so you see this 11 to 21, so I got CDC data, and these are deaths. And so there's actually been a 40% increase over the last 4 years. Of course, I work in the emergency department in Georgia. So this is something I definitely see. And this is why this has been such an important thing for me to look at and research. In fact, this is what kind of brought me to this topic, is that I can physically see this change at my own workplace, and this is what brought me into this. So I mentioned a couple of times about different databases, and I talked to you about something called the Dickey Amendment, which is no more. So fortunately, over the last couple of years, as for those of you guys who listen to the news and things like that, there has been more funding for firearm research, but we're super behind because there's like 20 years of no funding. one of my mentors in firearm injury research has actually used his own money. He's an emergency medicine doctor out of California, and used his own money for many years to fund research. And now, of course, is well known in the field because he uses his own money. And had to get resources, but had to get research money from other private organizations. But now the CDC is funding. What the CDC wants to get is real-time data. It's not just the gun violence archive that is someone else that took it upon themselves to do it. They want to get real data. So the Georgia Department of Health, Public Health, like other departments of public health in the country, actually have come up with this real-time data where they actually get information really simply from hospitals. So the hospitals have to fund this and filter this information to the databases anyway. And so now the Georgia Department of Public Health is now keeping data for real time. Now their data only goes up, and I think eventually their goal is to be able to have it to you quarterly, so that by now we would have January through March of 2022. We don't have that yet. So this data is only from last year, but this is what I can tell you and see how they slice and dice. There's 11 to 24. I can only get 11 to 15 or 15 to 24. So I just was like, okay, you're gonna miss a whole group if I don't do this. So I just gave you 11 to 24. So for 11 to 24, they had 1,799 ED-related visits for firearm injuries in Georgia last year. And so, and this pie chart shows you look at this one, you can even see how that age range is the age range that's the highest for the ED-related visits from firearm injuries. And this one, of course, shows you that how most of it's now. And if you really want to slice and dice and go to, really all you gotta do is put in Pastor, Georgia, and you'll get access to this. And you can look in slice and dice it, and you can see what your county has, and where you live, and how many firearm injuries happened in 2021 in the county that you live in. So it's a really great source. And like I said, this is from a CDC funded grant. The goal would be to have every state involved. They're piloting this and practicing this. This is how the database that Nisha and I quoted earlier, it started off sort of like that too. And as of like maybe, I think 2019, 2018 is when they actually got every single state to even report deaths. So eventually we'll have real-time data on firearms. So just for your information, Georgia is 15th in the US for firearm-related deaths. So we're like, that's where we are in the place, number 15. And so out of 50, obviously. And then we're 10th in this for the South region for deaths. Yeah.
The very lower part, we've got county, I think that says Garden County. That's where I'm from, so I'm trying to look and see.
What is it? So it's firearm related injury by ED visits by race. Which one are we trying to get?
By county.
Oh, so yeah, so that's basically percent firearm related injury visits by county. So I think it looks at your population too.
So if you
And it looks at, and like based it off like also like the population, also they do calculations based on ED visits. So when you go back to their dashboard, they will say there's like what percentage of firearm visits compared to all the ED visits that they're having. So 2% of their, I believe this is how many based off of all of their ED visits. So 2% of their ED visits
We're
are.
having a lot of related drive-by.
Oh, so that's probably why
Yeah.
it's higher.
And younger kids are getting caught in all this part of that. Well, this is one thing that look guys, sleeping, but.
Yeah. Yeah, so that's what that depicts. Yes, ma'am.
What site did you say?
Oh, it's called Faster. Literally, it's Faster. Just put FASTER, and you might not even need to put Georgia, but it's from the Department of Public Health. It's a great dashboard. Yes, ma'am.
We also marked this targeted, we are the market for 10 to 12 counties. Rural Georgia, where
Right.
have it all the time.
Yeah. So, and actually, you know, they're looking for information. This is new. This grant is new. I would think that would be something they would be interested in knowing. You know, how do you slice and dice that? Because we're attributing a lot to Downey County, but maybe, and I would imagine they're looking at where they're born to. But yeah.
I would think because they've gotten rid of so many rural hospitals and people have to travel a long distance, but I don't think it's all
This is
County.
county of origin, this is county of origin.
I would imagine it's probably Florida County of origin too, but I think it still would be interesting to look at the hospitals and see the difference. And slice it.
What's the, you're right.
That's what we're done.
And then
We feel
Got it.
But you-
Interesting.
This county of origin days.
Yeah, I think it is a county of origin, because they get their zip codes and things like that, where people live. So I actually looked at the counties and I was like, where are all these people places at? There's so many counties in Georgia. Which makes it fun, yes, it does. So moving on, I don't want to use up all of our time, but these are great questions. So I'm gonna give a run through this part a little bit faster because you guys aren't asking some of this. So firearm access, so how do people get access? First of all, I want to talk about ownership. So why do people actually own a gun? So lots of different reasons when you actually ask people, but 63% is for protection, 40% is hunting. We talk about hunting. Actually, what has gone up is actually when you look at charts for like hunting versus protection. So like 40 years ago, most people owned for hunting, and it's actually gone up that more people own for protection and less people actually own for hunting. Recreation and sports is a smaller percentage, about 11% in the first line of duty, about 5%. There are about 6% that actually just have family heirlooms, so like, grandmother passed on, the grandfather passed it on. We talked briefly already about the differences in kind of the ownership, but basically there has been an increase in like everybody purchasing guns. We talked about the periodic shift, so I'm gonna skip that. So access, how do children get access? Everyone's like, well, why do they even have access? So 4.6 million kids actually live in a home with a loaded, unlocked gun. So basically that is what we consider unsecured, not secure. Loaded access, easy access for the kids. The most frequent cause of unintentional death would be just plain, just like as you can imagine, that's the most frequent cause of unintentional deaths. Most suicides actually occur, and it's actually, there's been shown that suicide rates increase in the home of the victim, family, or friends when about 2 to 5 times in children and teens when there are actually a gun in the home. So having a gun in the home increases the risk. And it's much more concerning, obviously, when there is, even when there is not any mental health issues, this can happen. And additionally, what really matters is kind of like the means. One of the things we always like to talk about is the means matter. And so as you look here, the pediatric firearm-related suicide, the fatality rate in general is 90%. You pick up a gun, more likely to be successful at your suicide. You use poisoning, you are less likely to be successful. So cutting in drugs, the fatality rate is 23%. So means matter and actually increases your chance of death.
I have a question. When we just had this new law passed in Georgia, were these statistics for Georgia that you just showed? Just had this new law passed in Georgia where the access for guns is so much easier, but training's not, in terms of how to manage the gun and what to do. Like, there's no regulations that say you have to be trained to use it. You have to be trained to drive a car. And so I think, I would love the legislators to just hear and see that, so.
So you keep having these big questions that we're gonna get to. We're gonna talk about legislation.
Okay.
And so then you'll see how legislation can impact those kind of things. That's actually a really good point. So as I mentioned, so the odds of a gun in the home being loaded and unlocked is very high when it's being used for protection, which would make sense. I mean, using protection, you want to keep it near you. If it's a handgun, if the owner is a female, so interestingly enough, females are more likely to have their gun insecurely or not securely stored. And that, of course, unfortunately increases adolescent access. So there was a study done, a survey that was done of parents, a large percentage of parents who actually owned guns, and they surveyed the parents and the children. And they found that if there was just one firearm in the home, the child would say that they could access the gun within 20%, and within 5 minutes, about 20% of the kids. So 1 out of 5 kids, they could access the gun in 5 minutes. When they found that there were actually 5 or more guns in the home, 43% of the children said they actually could access the guns within 5 minutes. If all the firearms were locked up, only about 23% of them reported access. So when you had locked up guns, they were less likely to report they had access. But if they were unlocked, about 45% of them. But on the flip side, remember I said they interviewed the parents and the teens. So teenagers, we all know teenagers. When they talked to the parents, 45% of the parents who did not own and 33% of the parents who own contradicted their children. I mean, they asked them, do you think your kid can get access to the gun? Like, no, absolutely not. But when they actually asked the teens, it disagreed. We did a similar study in our local hospital in Georgia and found the same thing. The teens disagreed. And I guess if being a mom of a teenager, I'm sure that's true. There's so many things that they can figure out how to get access to. My favorite thing to tell people is that, your kids can find what was supposed to be Christmas. They find your Christmas present. Why can't they not find your gun? They find everything else. I was just telling my colleague Nisha how my son got hold of my credit card, which really wasn't hidden, and plugged it into a system to charge some stuff. Kids get into stuff because they want to. Go ahead.
Local pawn shop, I live downtown, hospital, this young man who I had to take to school, he his brother, and their mom was single mom, missing the bus. One day, the brother had a girlfriend, had a gang, she had a gang brother when we got to a competition at school. We had an AK-7 being shot up in the air in our neighborhood by that night. We had a gang task force, we had street police, bar return, the people that we had to get involved. And so this kid, he didn't have a gun, but by the next day, he had access. The afternoon, when the neighbor sent me a text, said, he's walking down the street, he showed all his new gun, and he's gonna get them to come back. This is not a gang kid, because he was defending, they shot him on the mailbox, and he was ready to defend what you call his house.
It's so interesting. So my next slide talks about how if you're bullied, 3 times more likely
Yeah,
to actually get access to one of our. So you're like, you guys are like almost going into everything. So yeah.
It was an overnight, boom, here we go.
Yeah.
And thank God, the police and the people who work with these young men, and I'm talking, they were on it, because they've been watching some of these kids at school anyway. They arrested like 14 gang members on Monday to school, and they were exposed to gang activity down in town. I'm gonna tell you what, it was scary after his mama and his sister. It could have been
Really deadly. Absolutely. And I mean, I think, that shows you, like, his first thought was, let me see if I can access, because of course he's being bullied and being mistreated. And then once again, impulsiveness. And, what happens is that people will just buy guns for other people. Straw purchases is not a big deal. It's a really, really big, that's how people often ask, how are they getting a gun? So straw purchase, okay, I give you $100. I want money, I don't really care, so I'm just, I'll buy a gun for you, sure. The same way that people, give kids fake IDs or buy alcohol for them. It's not any people, there's a lot of not thought process. So anyway, this is another survey that shows that how they compared youth in Colorado, which Colorado's great state is as urban and rural areas, that they can do a good survey, and they found that the rural kids actually felt like they had better access to guns, like 36% of them did compared to the urban kids. And what they found when they looked at the kids who had the access, they found that having more access correlated with increased suicide thoughts, planning, and actually attempts. And like I said, bullying increases the risk of getting access. This is another just quick study that also talks about how access with rural youth, and how this one I wanted to kind of point out at the very bottom, how many percent, what large percent of them actually had seen, 95% of these rural youth in Iowa actually seen someone being threatened by a firearm. And so we talked about the urban-rural divide, and one of the things that we as firearm injury prevention researchers will look at is that we talked about the fact that it's multifactorial in how you prevent firearm injury and death. Because what I will do for rural, for parts of Georgia is going to be different than what I'm going to actually recommend for the urban parts of Georgia. And that's something I think is really kind of missing in some of the discussions when we talk about how to prevent firearm injuries, because every area is different. And as you'll notice, many of the teams felt that there should be some safe storage laws, even though they have easy access to guns. All right, so we talked about some of the access in Georgia. I'm trying to think what's important from this slide. We talked about this stuff already. So this is just a study that we did at our own hospital. We found that greater than 50% of children, greater than 50% of parents did not store their guns safely. And this is people who came to the hospitals that I work in. And 23% of them would actually trust their child with a loaded gun. When we interview the children, we try to just show them a picture of a fake versus a real gun, just to show parents the fact that, you know, kids don't easily decipher between it is a toy versus not. And 75% believe they could tell the difference, but they actually could not tell the difference. And about most of them actually got it. And I'm gonna just quickly just show you that, once again, a large percentage of parents who are coming to our institution are actually storing their guns incorrectly. People on Zoom can still hear. It's got this message, I'm not sure. All right, so what makes adolescents actually carry guns? So the rates of carriage actually increase over time. Most of them kind of carry intermittently. Black adolescents are more likely to carry, but as we talked about before, there's lots of other risk factors. So availability, mental health issues, poor school performances, delinquency. We talked about the straw purchase earlier. Some of the protective factors, this is really important. What can we do to prevent this? So attachment to a school, parental monitoring, so realizing their children are doing this. Neighborhood collective efficacy, which is actually sort of the example this young lady just gave about how they got a hold of this kid who was actually walking through the street. Police policies restricting firearm access, which what your question was asking about earlier, which we're going to get to. So some of the other characteristics of behavioral risk factors, and we'll try to see if there's anything. Some of the risk for access is what I'm just going to briefly run through, as we kind of don't want to use up all of our time, is alcohol and marijuana use, fighting behavior, current suicidality. So this is really important. The mental health world is asking about, you know, access to gun is a really important thing to that way to help to actually determine if kids have access. This study out of Philly found that 1 out of every 6 of the kids actually did have access. And this is actually a study from kids who are already violent, who already been injured by firearms. And so this is just a little bit of information about what they were like. And this is actually also an urban study. So they found that most of them were male. Of course, again, they either separated or divorced parents. They had suffered some type of violent loss already. So they knew someone who had already been injured. Often had gang affiliation, substance use, and also often had been on probation. So when we're thinking about targeting urban youth, these are the type of youth that we should target as we're thinking about what do we do to prevent firearm control. Now to your question, legislation. So what age is gun ownership legal? So you can get from a federally licensed gun owner, anyone can buy a gun at 21. You can sell guns to 18-year-olds and above in Georgia if you're not federally licensed. Like I can sell it to someone if I had one. It's not legal to sell a gun to someone under 18 years of age. And there's technically no federal minimum age for possession of a long gun, but those are not generally used as often, but that is technically the law. All right. So yeah, so what you actually put, so AR-15 is technically not considered that, technically not, but yes. But we're now going to talk about the new law that was just passed. So the Bipartisan Safer Communities Act that was passed a couple of days ago. So extended background checks, which I think, so some people felt like this law was not as effective or impactful. As someone who is happy to get a crumb, then no crumb at all, I will take a crumb. Because one thing that they did was they extended background checks for 18 and 20-year-olds, which is what I take care of, right? And this is the impulsive move. We talked about the age-range people who were the more frequent shooters recently. So I think this is helpful in increased support for state red flag laws. You want to know what state red flag laws are? So red flag laws are basically where healthcare providers occasionally, but definitely police officers and family members can say this person is not safe, and they will actually request that they don't have firearms at home. It disarms domestic abusers, which is also a significant, impactful part of overall firearm deaths in the United States. Crack down on gun trafficking across states. So, for example, we all hear about Chicago having lots of gun violence. So most of the guns that actually cause problems in Chicago were not bought in Chicago, they're bought in states that actually have lenient laws. So it helped to crack down on that. It funds community violence intervention programs. We're going to talk about some of those. And also invested in mental health and provided for safety
for schools. So are these acts actually really helpful? So there was a Crime Control Act in 1994 that actually banned handgun purchases for kids under 18 years old and actually found that unintentional injuries and suicide death rates actually fell. So they are impactful and they are helpful. Also found that 17% of incarcerated offenders would have been prohibited from buying a gun if we had a state minimum age. So if we actually looked, there was an study that actually looked and saw that if we had a minimum age, you couldn't buy a gun, then there might have been less people who would have been incarcerated. Young people between the ages of 10 and 21 were arrested. Another study kind of looking at where they were arrested for offenses, they actually made up a significant percentage of those who were arrested for weapon offenses. And the final thing is 18 to 20-year-olds, only about 40% of the population, 4% of the population, but they're actually 17% of known homicide offenders. So once again, the law could really be impactful because if we just get that age, we will make a little bit of a difference. So we're going to talk briefly about child access laws, and we'll talk about where they fall. So there's two different types of child access protection laws. There's recklessness laws that relate to providing firearms to minors, meaning that I give a gun to my son in Georgia, that's illegal. I cannot give a gun to my son to say, go shoot someone. That is illegal. If I give it to him for legal purposes, that's illegal. But I can't take my son on a shooting range if I want. And that is legal because we're not doing anything illegal by shooting animals or whatever we're doing. So Georgia technically does have a recklessness law, but obviously it's pretty weak because anything that you do, if I gave a gun to an adult for illegal purposes is illegal too. So it's not really the strongest law in the world. Negligence laws are really considered actually much more strict because they actually then require you to actually store your gun safely. And so there's 16 states that actually have that. There's no federal cap law. This is just a picture of when states have cap laws. Remember, cap laws are recklessness laws and negligence laws. So as you see some of the states in the South that actually have higher incidence of firearms, they do have cap laws, but most of them are just recklessness laws. So I've already kind of gone through Georgia's law. If you want to take a quick picture of it, you can, but basically I kind of went through what our law is. So do child access, oh, I'm sorry, I'll go back. Do child access prevention laws actually make an impact? They do. So what we've found is that child access prevention laws have been shown to decrease suicide dramatically. So in Indiana and Massachusetts, they found significant decreases in suicide once they started their child access protection laws. So they do make a difference. And it actually just decreases the rate of adolescent injuries. So they're impactful. Adolescent suicide rates have been shown to be higher when there's actually ownership of firearms in the home. So once again, when states actually mandated on gun laws, you actually decrease suicide. So yes, they are impactful. Homicide, unfortunately, it's a mixed picture because homicide, remember, is intentional as opposed to unintentional. So there's other factors that play a role. Yes.
I have a question about the previous slide.
Yeah, sorry.
On there. So states that mandated gun laws, I mean, how does that get enforced?
It's a great question.
I mean, it sounds like in theory a great idea. But
Yeah.
the reality
So it's enforced. So basically, that is, so a lot of times they actually sell, they require them to be sold when you actually purchase a gun in that state. So that's number one. The other thing is what they have found is that if you are punished after the fact, it is still impactful. So someone got a hold of the gun and you're punished because they should not have had the gun.
Yeah.
And then similar to actual seatbelts. Our seatbelts technically enforced.
That goes towards that, like the laws that you have on the book, on the books, as it relates to neglect or what have you. You're saying that carries weight in those particular states.
In those particular states. So I mean, think about it. In a lot of states, when you get fined for not, the police officer usually doesn't stop you because you're not wearing your seatbelt. They stop you for something else.
Right.
So similar, and but do you wear your seatbelt?
Yeah.
Yeah. You know what? When seatbelt laws, I always talk about seatbelt laws and firearms in general and child access laws, because when seatbelt laws are passed like in the early 80s, people were like, I don't want to wear a seatbelt. I'm not wearing a seatbelt. High percentage of people, over 90% of Americans wear their seatbelt.
So I say that because people are like, oh, this is never gonna be impactful on safe storage. I would disagree. I think people will, the more it's actually pushed and is forced, just like how people eventually start wearing masks. I think the same thing will happen with safe storage. If you make it part of a communal, you get a gun, you have to store it safely. And that is how it's impactful in those states also. All right, so mixed picture with homicide, unfortunately, it isn't as impactful to reduce homicides in children. This because basically there are so many different reasons why. But it does seem like background checks required permits does appear to make a difference. But once again, it's a mixed picture. So child accident prevention laws that impact on unintentional injury, definitely impact on unintentional injury. States with cap laws in place found a decrease by 23%, so definitely impact there. In unintentional injury, only for children in states which the law is a violation. So, for example, in Massachusetts, which is where some of my other firearm injury researcher mentors live, they have a significantly lower unintentional firearm injury death compared to Georgia. I'm not going to talk about airfall laws because you all also knew about them. So we're just going to talk briefly about ED interventions. So different type of interventions that can be done in emergency departments versus community interventions. Basically what we found is asking about the presence of firearms in the home in a child who has mental health issues is impactful. Pairing it with actual intervention where you actually distribute a lockbox is impactful. If you don't ask, that is riskier. The other things that we found is that there's certain screens that can help you. Some of the same risk factors that we talked about before, things like those who are in, have those teenagers who are more likely to be involved with fighting. So screening those kids who are just coming for just fighting related assaults. Early on, you can decrease the risk of later on coming for firearm injury. So briefly, I'm going to show you all different types of safe storage devices. The best is lockboxes. Lockboxes, I say, are the best, in my opinion. This is why. They're inexpensive, relatively inexpensive, and you can get like a biometric version of them where you just have your fingerprint, or actually a combination, which is harder for someone to guess, and it isn't as costly. So as you can see, they go up from $20 to $70, whereas a gun safe $500 to $1,000. And as I said, most people own their guns for protection, so this gives easy access for someone who actually owns a gun. The trigger locks and cable locks are cheaper. Cable locks are required by law to be distributed by federally licensed gun dealers. So if you go to a federal licensed gun dealer, they can actually give you one, but they're easier to manipulate. You can find the key, you can cut the cable. It makes it harder access for the gun owner if they're using for protection. So hospital-based intervention programs, there are lots of different ones. What their goal is basically teenager, youth, person comes in, shot by a gun. What can I do to actually intervene at that point in time? They have case managers who work with those families, work with those patients, wraparound services, social workers. They have been shown to reduce firearm injuries, recidivism, so meaning coming back for another injury in the future. Then there's community-based programs. So there's a group called Cure Violence. There's one that operates in Atlanta. There's some of them all over the U.S. There's 20 different U.S. programs that are all over the world. The one that's in New York has actually shown that there's been a 63% reduction in shootings due to their program, and 37% reduction in gun injuries in that area of South Bronx where their program actually runs. So they have definitely been very effective in the areas of their poverty reduction. So there's definitely been some studies that show that there's a direct link to gunshot injuries and poverty. So that is why there are programs that are called community greening programs, where they try to actually reduce crime. So in the community greening programs, what they find is something simple. You find a vacant lot, you might have heard of the vacant lot programs. You make sure it looks pretty, you put grass on it, you clean it up, you make sure, and you can actually look like someplace someone wants to live in. They have farms there and things like that. Simply, community greening has actually reduced assaults and injuries and firearm injuries in communities. There have been studies in Philadelphia and some other cities where that's been done. Gun buyback programs, so lots of places actually advocate for that. Mixed effects. Oftentimes when we talk about Massachusetts, United States, people will compare it to Australia, where they had a massive government gun buyback program, and they definitely had a significant reduction in firearm injury and death in Australia. And the reason why people feel like it's mixed effects is that it needs to be paired with lots of other pieces of information and pieces of other legislation. And Australia actually did some of the legislation, so that's why it was probably more impactful. But it's good for public perception. So it actually makes people think, oh, you know what, my state, my country really cares about reducing gun injuries, and so the perception is important. So I talked a lot about some very kind of, what I tell people is sad, it's kind of distressing statistics. You're like, oh my goodness, why is this happening? It can be very distressful. But I definitely I always talk about seatbelts in this discussion, because I talk about the fact that a lot of people didn't wear seatbelts. Other thing I talk about is that, you know, many of us look like we probably grew up before there were laws where you couldn't smoke everywhere. And think about the fact that you can't smoke everywhere. And so the impact that we now had on cigarette smoking, we can have the same exact impact on gun violence in this country. And it may take a number of years, it will, because it took a long time to get to where we are at. But we can definitely have the same impact, just with a lot of great public health approaches. So these are the things that we, as people who care about this issue, can do. We can educate ourselves, first of all. Start with our own community. Make sure we have a gun in our home that we store it safely. The safest way to do that is making sure that it's unloaded, locked up, and the ammunition is stored separately. Support community violence intervention programs. It sounds like in the county that you guys are adults, you could really probably use some community violence intervention programs. Advocate for gun safety legislation. So now that we have an open carry law in our state, we also should pair that with a child access protection law that is not reckless, but negligence, where it's actually required that people actually store their firearms safely. And then advocate for more gun violence funding and research, so that we can actually get to the root of why is there more gun violence in one area compared to another, and actually figure out how we can reduce the gun violence.
So if the gun is safely stored in the automatic box, does the ammunition still need to be separated?
Great question. Great question. So the right answer, the right answer, absolutely. The right answer is yes. But I live in the real world.
Thank you.
And I would say that if the gun is completely stored safely and there's no way to access it, in theory, you should be okay. But because once again, 60% of people are using it for protection. And if you're using it for protection and your ammunition is stored separately, you don't have it, that makes it hard. And I understand that.
500 does seem like the safest.
And it definitely seems like it's the same. You know, and I want to get Dr. Agarwal's opportunity to come back here, but I wanted to say that one thing we often say in gun violence research is that we didn't tell people that, you know, there's so many drownings in the United States, we can't have a swimming pool. We didn't say that. We said, how can we make our swimming pools safer? Right. Fences around our pools, we have lifeguards, we have swimming classes for kids. We need to do the same thing with guns. How do we make the world that we live in with guns safer?
That's one of the things that I like to also mention, because it's just like everything else that can cause harm to people, children. Nowhere in there is there more about gun safety being taught. Like our girls, we have an abundance of handguns and rifles. We're both, all of our girls are hunters, all of our families hunters, plus shotgun team and everything else. But they don't have to reassemble and everything else. Everything's kept separate. But they were raised to know how to handle, how to, they were educated, just like.
So you're educating children. So I think that is definitely important. What we found though is more important to educate the parents.
Well, that's
than to educate the kids.
Parents need to educate their own children. Right. In a sense of, yes, if parents need to take some ownership of this too, if they're going to have homes. Right. Is what I'm saying.
Yeah.
All of these things are great, but if a child still sees these things and they're like, okay, so shut. More than one.
So what to do when you come across a gun?
Parents need to take some ownership in trying to reduce some of these things from educational concepts.
Overall, though, in injury prevention, we often talk about the parents being involved. It's like we don't want think about the car seats. We don't tell the parents to have the child be educated about the car seat. So that's the reason. I understand what you're saying, but in general, the thought is educate the parents on how to keep it safe, how to keep their environment safe. You know, like you keep your poisons locked up. So really, yes, there should be a response to what your child should do if they come across, because you know maybe they will go to some friend's house where the gun is not stored, and that is definitely something. Yeah.
We can have all way, like you said, kids' minds are gonna wander.
Right.
A lot, and they need to be taught
What to do when they come across it.
what to do if their friends are coming across things or they're at a friend's house, because the friend's house may not have them under safe locking.
Absolutely.
Like we do at our house.
Yeah.
Which is why we also should ask before we let our friends go to other people's homes, because you don't know how they store their guns. But I'm gonna let Dr. Agarwal finish up.
I'm gonna go really fast, and I fully recognize that we're running over time, but I also think that talking about firearms is so critically important, which is why I wanted Dr. Fraser to really lead this conversation. She's clearly an expert in the area, and it's so critically important. We want to make the biggest impact on adolescent well-being. The second biggest cause of injury-related death or death overall for adolescents, however, is car crashes. It used to be the leading cause. I do want to go over a little bit of this information. And when we think about car crashes, right, it's, you turn 16, you get the keys to the car, it's super duper exciting. You gotta remember, when you're giving your teenager the keys to a car, you're giving them keys to something that could be potentially deadly. They do not have frontal lobes developed. That is an important part of impulse control and judgment. So we're giving them something potentially deadly, but their impulses, as we talked about. And they also tend to have this kind of invincibility mindset where they think, oh yeah, people might get injured from this, but it's not gonna happen to me. I'm gonna be fine. And this is important because novice drivers, people who are in the first 18 months of driving, are at the highest risk of getting into a car crash. They are at a 4 times increased risk of a crash or near crash when you look at data. So these teenagers who are getting their license for the very first time, these first 1,000 miles they're putting on the road, they are at the highest risk of getting into a serious car crash during that time. There are a lot of factors. Seatbelts is a big issue. So for the youngest age group, we talk about adolescents, they need to be sitting in the back seat first and foremost. This is because we know airbags can be deadly for people who are short. And working with the ED, I definitely come across like 10-year-olds and I'm like, oh, hello, hi up there, you're so tall. But they also don't have skeletal maturity where the seatbelts are going to sit and function appropriately. So first and foremost, they need to be sitting in the back seat when they're under the age of 13. But then we also know that 1 in 4 teens don't. 1 in 4 teens do not wear a seatbelt every single time. This is the age group that has the crappiest seatbelt use across American demographics. Okay, so we really need to make sure that we're enforcing this with teens if we want to keep them safe in vehicles. And we know that seatbelts work. They reduce the risk of death if you're in the front seat by 45%. We also know that teens are inexperienced, and this comes out in how they drive, how they anticipate hazards, right? So if you're the teen here in this little car in the back, you might just be focused on that SUV that's right in front of you. But you guys look at this as experienced drivers and you see, oh wait, they're tailgating another car, and there are all these other trucks here on this lane, and oh, we're in a wooded area, so maybe a deer might turn into the road, right? Scanning, that takes practice. It takes time to get really good at that. This is one of the reasons why teens are more likely to get in crashes. Risky driving, such as speeding and tailgating, changing lanes is another risk factor for these teens in car crashes, as is distracted driving. A key point I want to make is that we tend to really hone in on the texting and talking on the cell phone, but distracted driving actually includes things like changing the radio. It includes putting on your makeup. It includes eating or drinking while you're driving. These are things that take your attention away from the task at hand and can be deadly. Similarly, riding with passengers is another risk factor. So there is the distraction of talking to your passenger, and I literally just drove here with my mom. Who's like, let's talk about all these stressful things while you're driving down the interstate with all these big traffic trips. Like, let's not talk about that right now. Like literally, as we're like getting into this heavy traffic in Savannah, she's like, so talk to me about why kids need to be rear facing as long as possible. I'm like, this is what I do research in. Why do you need to talk to me about it right now? But we also know when it comes to teenagers in particular, having passengers is very risky, especially other teen passengers, okay? We know that if you have your teenager and you've got another teen in the car with you, you're 2 to 3 times more likely to engage in risky behavior that you wouldn't do if you're driving by yourself. And this effect is even worse for males. Drowsy driving is another risk factor that I usually don't think about when I'm thinking about teen drivers, but they tend to underestimate the impact of fatigue on driving. I actually had a high school classmate who fell asleep at the wheel and died in the context of drowsy driving. Part of this is also society's fault. Biologically, adolescents are primed to want to stay up late and wake up later, but society says, no, school's gonna start super duper early. And so they're simplified as it is. And then there's also impaired driving. Again, focus has really been on alcohol, which has been implicated in over 10% of these adolescent fatal car crashes, but things like marijuana and prescription medications, which might be illicit, like opioids that you're taking to get high, versus medications that you are legitimately prescribed for medical purposes, can also have an important role in car crashes. And then unlicensed driving is something that it blows my mind because I would have never thought about getting behind the wheel of a car when I did not have a driver's license. But it's actually, if you ask teenagers, it's something like 15% of them have gone behind the wheel to drive when they did not have a license, and is implicated in a significant proportion of car crash fatalities. In fact, I think we were working together this weekend when we had a twofer trauma come in, the 15-year-old who was driving, didn't have their license, with their 13-year-old brother with them, both unbuckled and significantly injured, as you can imagine. So what can we do to try and prevent car crash fatalities? Time. So supporting legislation. So graduated driver's licensing laws are now in every single state in the District of Columbia. And these have improved their work. They reduce adolescent crash rates and fatalities by 50%. Okay, so even though you might have a teenager who's bellyaching about, I just want to drive by myself, it's really okay, don't let them do it. Georgia's law, to go over it very quickly, is 3 stages, as are most states. You get an instructional permit at 15 that lasts for 12 months. And to get that permit, you have to pass a road rules and road signs test. And then during that period, you are supposed to approve 40 hours of supervised drive time with an adult who's fully licensed and 21 or older. And 6 of those hours have to be at night. States have different rules about these hours. Some of the colder climate states actually include snow driving, which makes sense, right? After you've had that permit for a year and 1 day, that is when you can get your provisional license. So to get that license, you also have to complete 30 hours of classroom instruction, an alcohol and drug awareness program, and the road skills test. So that famous test where you're behind the wheel and there's someone sitting next to you and saying parallel park here and what have you. Once you have that license, there are still more rules here in our state where you're not allowed to drive between midnight and 5 a.m. Nighttime driving is a big risk for crashes in adolescents. And the first 6 months, you can only drive your immediate family. That is the only people who can be in the car with you. After it's been 6 months, you can have 1 non-related passenger who is under the age of 21 in your vehicle. So if you're thinking about it, for me, I think that's the first chance that some boy could take my daughter out on a date, without anyone else in the car, or some girl could take her out on a date. And then after that initial 12-month period, at that point, you can drive with 3 or less passengers. So if you are a 17-year-old football player, you cannot drive a minivan and put as many people of your football team in that vehicle. You still can only have 3 passengers. And then at 18, you get your full license with no restrictions.
Yes.
And no, unfortunately. So we can also support other legislation to keep people safe. So seatbelt legislation, we have laws in every single state. Our state has a primary enforcement law, most states do, which means if a cop sees you without a seatbelt on, they can actually pull you over and ticket you for it. That is the most effective seatbelt law. Laws regarding distracted driving and driving under the influence can also be really impactful. And then supporting alternate modes of transportation is something else to think about when it comes to keeping teens safe. So rideshare programs for if someone is using substances, is especially important for those of you who might work where there might be college campuses. But really, we need to talk about parents when it comes to preventing these adolescent and teen crashes. They have a proven impact on reducing traffic violations and crashes in the adolescent driver. If your parent or caregiver is involved, the risk of getting in a crash is 7 times lower than someone else. Like, here are your kids, peace out. So first and foremost, it's role modeling. So it means that it starts as soon as your kid's getting in the car with you. It means for me, when I have my 8-year-old daughter in the car, she knows that my job is to drive safe. So she likes to tell me to put it on Sing, put it on Trolls, put it on Frozen, tell me how to change the piece. I'm like, what's mommy's first job? It's to drive safely. So you are just gonna have to wait. But the thing is that we're not great role models. When we talk to teens, more than half have seen a parent talking on the phone while driving or been in the car with a parent who's texting. This is really, really important to remember. You can't all of a sudden start doing this when they turn 15. They've been watching you all along. So it's the same principle, right? Like if you expect your kid to wear a seatbelt, you've got to buckle up. If you expect your kid not to play with guns, don't play with guns irresponsibly. They're gonna mimic what they see us do as adults. And then teaching is another big role that parents can help support to help with reducing adolescent crashes. There are formal lessons, although many, many places are reducing free driver's ed in their public schools. There are private lessons that are available, but parental lessons, learning from your mom and dad is also important. As you can imagine, this isn't, there's no, is there really a manual on how to do this? There actually are a lot of manuals now and resources to help you teach your child how to drive. These are just a few of the resources. I really like CHOP's resource. Driving Home is from the National Safety Council. Every state, including ours, has their own internal driver's manual that teaches parents what lessons to go through. And I will tell you, I'm very biased, but I love Auto Coach, which is an app that was developed in Atlanta by the Shepherd Center, which actually coaches teens how to drive, or coaches parents to teach their kids to drive safely. What's nice about it is it actually includes extra chapters for teens who might have various physical or cognitive disabilities. So did you know that teens who have ADHD, understandably so, are at an increased risk of crashes? So there's an actual unit or separate chapter in terms of how do you accommodate that when you're teaching your teen to drive. And then giving them the opportunity for supervised practice is really important for caregivers. Let's see, we're running over, but driving contracts and rules can also be helpful in reducing the rates of deaths from car crashes. And then this is another point, is making sure you're putting that adolescent in the safest vehicle possible. And this is the one that I think sometimes blows people's minds. But if you think about it, I know when I was growing up, my parents went, sure, we're going to find you a car that we can buy for cash. It's probably going to be 10 plus years old. But you really want that novice driver in the car that has the latest and greatest safety technology. So things like rear view camera, automatic braking, lane maintenance, assistance, right? So I'm not saying you need to go out there and buy your teen a brand spanking new car, but you may want to rethink that idea of getting a car that's like 20 plus years old, right? Poisonings is the third leading cause of death in adolescence. And so what I'll say very broadly is if you want to prevent the most number of adolescent deaths, you need to address first firearms, second car crashes, and third poisonings. If you do that, if you could wave your magic wand and Harry Potter away those three causes of death, we will save 75% of the lives lost in that age group. For opioids, it's probably all the things that you have already heard about. We have to remember there are other things that go into the poison category, but 97% of the poison deaths we're talking about here are opioids.
Why'd you put TikTok there?
The TikTok there. So we've actually had teens who've died from the various social media challenges that are out there. TikTok being one of the social media challenges where people are putting stuff out there. So a couple years ago, there was the Benadryl challenge, and these always cycle through periodically. And Benadryl is actually very, very, very deadly. The most recent one that I've seen has been ibuprofen. There's been a Tylenol one, which can be a very deadly poison as well. So you have to keep an eye on this. These are teens who are usually not trying to die. They are just trying to be cool on social media. So the other piece I'll say about opioids is that the overwhelming majority of these opioid use disorders that will ultimately fatal start in adolescence. So addressing this in your adolescent population is not only going to help save adolescent lives, but adult lives in your community. And most of the time it starts off with the adolescent getting a legitimate prescription because they broke their ankle, they had to get dental work or something else. So the ways to prevent these deaths include education to the lay public, includes increasing access to naloxone or Narcan, so making sure that people can get this medication at the pharmacy. If a loved one is on an opioid. Support treatment programs, and this is really critical because we know access to opioid treatment programs is actually suboptimal in the adolescent program or adolescent population. And so this is something that we really do need to work on, programs that target adolescents in general. We need to increase medication take-back programs, think about harm reduction programs, as well as supporting prescription drug monitoring programs, and then increasing education in pediatric healthcare professionals. There have been some really good research out there that people who take care of adults know a lot about opioid use disorder and best prescribing practices and identifying this and treating it. But in the pediatric community, we're starting to learn a little bit more, but very few formal residency programs have actual training for this. And then in general, when it comes to poisoning deaths, disposal, safe storage, no transferring of medications and substances in general. I will tell you every single year when I look at the national poisoning data, there are kids and adults who die because someone thought it was a good idea to put a pesticide or cleaning object in an unlabeled water bottle for whatever reason, and then someone accidentally drinks it every single year. And then there are measures specific to substances. I will highlight that this whole new edible marijuana derivative is a brand new area that we need to get on top of. And there have absolutely been adolescents and adults who have died because they don't realize that these edible products have very high concentration of THC. And that sometimes these are adults and adolescents who are trying to get high, but unfortunately we're also seeing young kids get into these things because that looks like Oreos. And I know my 8-year-old loves Oreos and would eat that without a second thought. It's now happening to Dr. Fraser, Joe, and I. We're seeing it in our shifts, probably every other shift or so, someone has a patient who's done this. And then there are a lot of other ways that adolescents and teenagers can die. They're very creative. Drowning is the next leading cause of injury-related death, followed by other land transports, so things like ATVs, then falls, and then fires and burns. But I know we ran over. I really appreciate your attention. I will stick around for a little bit. I don't know if you can. But these are our email addresses if you want to reach out to us. Thank you so much for the work you do, keeping adolescents safe and promoting their well-being, hopefully helping them become adults who do amazing, great things and maybe solve some of these problems even more as they can.
Question. I have a question for you. Thought about, you said 50% of the people who 50% of folks who have firearms don't lock them up.
Yes, people go to our emergency department, but yes, a lot of people don't.
Yeah, so because they don't lock them up, how do you hold gun owners responsible when that happens? I think,
I think that's hard. I mean, as a parent, I am not really interested in holding parents liable. I think it's education, right? I think a lot of it's education. So one thing I didn't get the chance to get into, there's so much stuff I could talk about, is that we got a grant from our hospital system and from other, to actually distribute lock boxes. So when we distributed lock boxes, we've given away like 750 lock boxes of different like safety fairs, like we're doing one at the school event. Parents are like, oh my gosh, never thought about this. Yeah, I need to do that. And so we found that about 90% of the parents who did not have their guns locked up after them, less than half had them locked up before. 90% of them had their guns locked up when we pulled them 30 days later. And they also bought extra rights for their other guns because most people own more than one gun.
Yeah,
so it was
300 million guns.
Yeah. So when people get the education